Welcome to the National Health Insurance Administration. This is an overview of Taiwan's National Health Insurance Program, which was implemented in 1995 to provide health care for all the residents living in Taiwan. About 23 million people live in Taiwan, and more than 11% of the population is over the age of 65. Adjusted for purchasing power parity, per capita GDP was $37,737 and per capita national health expenditures were $2,499 in 2011. Spending on national health was around 6.6% of GDP. Life expectancy was 76 for males and 82.6 for females. Before the NHI program was created, Taiwan had several social insurance programs, such as labor insurance, government employee insurance, and farmers insurance, that provided medical care to specific groups. But only 57% of the population was covered by these insurance plans. In 1995, the government consolidated the medical components of these social insurance programs and launched a national health insurance program to provide health care to Taiwan's citizens and foreign workers. After the NHI program has been in implementation for 16 years, to better satisfy the demands of the population and accommodate the practical requirements of the program, the government has enacted the second generation NHI, signifying an important reform of the first generation. The second generation NHI was implemented in 2013. Here are some of the main characteristics of Taiwan's insurance program. National health insurance is a compulsory program. All residents must enroll. The National Health Insurance Administration is the only agency authorized to administer the program. The program is mainly financed by basic and supplementary premiums that are contributed by the employer, employee, and government. Those covered under the program receive services defined in a comprehensive benefits package, but they need to pay a co-payment when seeking medical care. It is optional for healthcare providers to participate in the program, yet about 93% of providers nationwide have signed contracts with the NHIA. Providers are reimbursed according to plural payment schemes under a global budget. The premiums and co-payments of the disadvantaged are subsidized by the government. The NHIA collects premiums from the insured, their employers, and the government. The insured pay co-payments when using medical services, and providers in turn file claims with the NHIA to have their medical costs reimbursed. Funding for the program comes primarily from insurance premiums, including basic and supplementary premiums. Basic premiums are calculated based on monthly salaries. Supplementary premiums are imposed on non-payroll incomes. NHI premium rates are determined on an actuarial basis. Meanwhile, the National Health Insurance Supervisory Board is responsible for the review and approval of important financial initiatives such as insurance premium rates, scope of benefits, and the growth rate of the global budget for the following year. NHI's finances are evaluated based on the principle of pay-as-you-go to ensure its financial soundness. The insured are classified into 6 categories and subject to different premium calculation bases and contribution shares depending on the category they belong to. Most salaried employees belong to Category 1. They have to pay 30% of their premiums, their employers pay 60%, and the government the remaining 10%. The government subsidizes 100% of the premium for low-income households and conscripted military personnel. To fulfill the ideal of universal coverage, prisoners are now also covered, and the premium is paid by the government. In addition to the basic premium, a supplementary premium will be collected under the second generation NHI. The insured will be charged a supplementary premium of 2% on other incomes received, including large bonuses, stock dividends, part-time income, interest income, income from professional practice, and rental income. The NHI program provides a comprehensive package of benefits that covers inpatient care, outpatient care, drugs, dental services, traditional Chinese medicine, daycare for the mentally ill, and home nursing care. Expensive medical services such as MRI, hemodialysis, and organ transplants are all covered if medically necessary. When visiting medical facilities, the insured must pay small copayments, which are $1.7 for clinics and district hospitals, $8 for regional hospitals, and $12 for medical centers. The copayment is partially waived with a referral. To ensure that people who really need health care do not lose access because of the cost-sharing mechanism, individuals who meet certain conditions are exempt from making copayments. If the insured requires stays in a hospital, they will be charged a fixed co-insurance that varies according to the length of their stay. However, this copayment is capped at around $1,033 per hospital stay and $1,733 for the same disease in a single year, the latter being 1/10 of per capita income. The National Health Insurance Administration has used a health insurance card with an embedded IC since January 1, 2004. The card contains records of a patient's last 6 visits, drug prescriptions, allergies, and consent to donating his or her organs. Among its many merits, it can be used to monitor high-utilization patients and detect fraud by analyzing data uploaded to the NHIA. It can also help track down communicable disease suspects in major epidemic outbreaks. In the future, cloud computing technology will be applied to give the card additional and more powerful functions. In order to provide more comprehensive healthcare to the public, the NHIA adopts multiple payment methods to reimburse healthcare providers for medical services. The NHIA initially reimbursed providers based mainly on a fee-for-service basis. Then, to better control medical expenditures, the NHIA implemented a case payment for simple and standardized procedures in 1997 and completed a global budget payment system in 2002. To further standardize the reimbursement of medical services, the NHIA initiated a resource-based relative value scale in 2004 and a Taiwanese version of DRGs in 2010. In addition, a capitation was implemented in 2012 on a trial basis. The average utilization rate of NHI outpatient services in 2012 was 15.12 visits per person per year. Those visits include visits for dental service and traditional Chinese medicine. For inpatient care, the average utilization rate was 13.77 admissions per 100 persons per year. The number of outpatient visits is substantially higher than that seen in many OECD countries. But on the positive side, this testifies to the convenience of visiting a doctor in Taiwan, for which there are practically no financial barriers. NHI premiums are calculated based on regular salary income. In recent years, however, salary income has steadily declined as a percentage of national income, leading to premium growth lagging behind income growth and funding shortfalls. The introduction of the supplementary premium on incomes other than regular payroll is expected to alleviate the perennial financial problems. For people who are less fortunate, the government provides several types of assistance to make sure they have the access to medical services, such as the premium subsidies, financial assistance for the near poor, and medical assistance for the disadvantaged. There are more than 20,000 healthcare institutions contracted with the program to provide medical services to the insured. The insured can receive medical services either by appointment or by simply walking in to a healthcare institution. Services are usually provided in a timely way, and waiting time is negligible. Beyond that, the NHIA initiated an integrated delivery system plan to improve healthcare on offshore islands and in mountainous areas by encouraging hospitals to dispatch doctors to these areas. This plan provides healthcare to 48 outlying islands and mountainous areas and serves some 400,000 people per year. One of the core values of Taiwan's health insurance is breaking down financial barriers to healthcare for every citizen by having the wealthy subsidize the poor and the healthy subsidize the unhealthy. This explains why the NHI can even cover patients with hemophilia, who spend 127.7 times as much as the average. The NHI program has earned a good reputation among Taiwan's people and is generally considered to be one of Taiwan's most popular public programs. The public satisfaction rate has improved from 39% in 1995, the NHI program's first year, to 61% in its second year, and around 80% more recently. Since its implementation, the National Health Insurance Program has resulted in a continuous and steady improvement in the quality of medical services in Taiwan, in part by bringing a great number of new drugs and medical technologies under its scope. Life expectancy has increased to 82.6 years for females and 76 years for males, and the infant mortality rate is 4.2 per thousand. Those numbers place Taiwan on top of many OECD countries in terms of the performance of the healthcare system. New drugs and state-of-the-art technologies covered by the insurance program have contributed substantially to quality of care. For example, the 5-year survival rates for colorectal cancer, lung cancer, and breast cancer in Taiwan are comparable to those in Australia and the US. Survival rates for patients receiving transplanted organs are close to the US levels. The major achievements of Taiwan's National Health Insurance Program include achieving universal coverage and providing easy access to medical care for every citizen at an affordable cost. Public satisfaction with the program is also high, and medical quality is up to standard. Under the second-generation NHI program, a linking mechanism between revenues and expenditures is expected to make the health insurance program more financially stable. The supplementary premium will see to it that those who are better able to pay contribute more to premium revenues. Moreover, by strengthening medical information sharing and encouraging participation from society in the NHI policy making, the quality of medical care will be improved and the NHI program can be sustained. We welcome you to visit our website at www.nhi.gov.tw for updated information. Thank you for your kind attention. We hope you enjoyed today's presentation.